Welcome to Beyond the Data. I'm Dr. Phoebe Thorpe. Today's Public Health Grand Round session is about addressing gaps in healthcare for individuals with intellectual disabilities. Over 7.4 million Americans have an intellectual or developmental disability. For today's Beyond the Data, we are honored to have a guest facilitator, Ms. Liz Weintraub. Liz Weintraub is a senior advocacy specialist for the Association of University Centers on Disabilities and hosts a weekly podcast called Tuesdays with Liz, Disability Policy for All. Liz will be speaking with the Special Olympics chairman, educator, and longtime advocate for people with intellectual disabilities, Dr. Tim Shriver. Thank you both for joining us today.
Thank you, Dr. Thorpe. I'm happy to be part of Beyond the Data with my colleague, Dr. Shriver. CDC has a long history of Special Olympics. Dr. Shriver, how has this partnership helped to improve the way we measure health outcome among athletes and in communities?
Thank you, Liz, and thanks for the question. It's an honor for me to be here with you at the CDC to talk about data and talk about what's beyond the data. For almost 20 years now, the Special Olympics organization across the United States, local programs, state-level programs, national-level events have partnered with the CDC to try to understand the health needs of people with intellectual differences, whether they be very young or very mature and into adult life. I think we've done a couple of things really well. The first is we helped together communicate to public health institutions and leaders around the country that we have a problem. Before we started working together, it was almost unknown that people with intellectual disabilities had lesser health outcomes than their non-disabled peers. So we helped illuminate the fact that there was a problem, and as a result of illuminating that problem, educating people about the problem, we have begun to catalyze action. Action at the level of understanding what are the problems, what are the heart disease issues, what are the diabetes issues, what are the ear issues, eye issues, oral cavity issues, posture and life course outcomes issues. So we've begun to illuminate these problems and help people to study them, help people to track them, follow them, not just for children, but for all people with intellectual disabilities. And as we've educated people about the problems, encouraged them to study them, we've also begun to catalyze action to address them. And when you think about issues like not eliminating people for pre-existing conditions, when you look at the training in medical schools and dental schools that's increased, we're starting to see the entire public health ecosystem, that means the whole range of service providers and educators and care providers. We're starting to see that whole system begin to recognize that people with intellectual differences deserve the same health care as everyone else. So for me, those are big outcomes, and not enough, but still very positive direction.
Thank you. You have spent many years as an advocate for people with intellectual disability. What changes have you seen in public health and health care for people with intellectual disabilities?
Well, the truth is that question is better answered by you than by me, because you're the person who's lived these changes in the same window of time that you and I have been able to be on Earth together. I grew up in an era where most people with intellectual disabilities, by some counts, almost 200,000 were in institutions. And so my first exposure to this population came in the form of recreation and play. As a very small child, 4, 5, 6 years old I was, during an era where many parents were still being told to let their children with intellectual disabilities go, to remove them from society. So it's a big change over the course of time. If you ask me to narrow it down, what's the biggest change? Why have schools opened up? Why have employers begun to open up? Transportation systems, housing, all these things have begun to change over that period of time. The biggest shift, though, in my view, is the shift from seeing people with intellectual differences as a negative, as a liability, to seeing people as human beings. And as the eyes of the public health institutions have opened to see not a disease, not a disorder, not a disability only, but to see a human being, we've begun to see these systems treat people as human beings, treat them as whole human beings, people who grow up, have jobs, get married, contribute to the community, pay taxes. All these things were unimaginable a few years ago. So we're only beginning. We have a long way to go in public health, but I think we've started the journey in the right direction.
Thank you.
Do you agree? That's the question.
Yeah.
Well,
Yes, I would also say that we need to believe in people with disabilities.
Yeah.
I think that if the biggest help that people gave me was believing in myself.
Right.
If people didn't believe in me, I truly believe that I would be in an institution or in somewhere that I would be behind a wall.
Yeah, beautifully stated.
Thank you. What are some things that public health program and healthcare can do to make sure people with intellectual disability are included?
Well, I think we have a lot of work ahead of us, Liz, and I think the guiding principle should be exactly what you just said. We need public health institutions, the entire array, to believe in people with intellectual differences. So if we really believed in them, we would understand their health conditions. We'd study the data. We'd understand the data of health and wellness, as well as the data of disease and pathology. So we have a lot to do just to understand the data and to capture it, to bring it together, to use data we have, but to get new data. Secondly, if people believed in people with intellectual disabilities, we would train every healthcare provider in how to care for them, in how to listen to them, in how to see them as human beings. Third, we would ensure that insurance systems and primary and secondary and tertiary care, all the care systems gave the time, the patience, the support to care for them, because people are different. People with intellectual differences are different. And they bring enormously beautiful differences to the human family, but it requires differences in the way in which we treat and care for them. And then finally, I think we would shift the paradigm. That's not plain language, you would remind me, but shift the way we think from disability to ability, from disorder to competence, from a liability to a person who brings value to the system. I think if we did these things, started to study the data, changed the training, ensured that care was provided, and focused on cradle to grave life satisfaction and thriving, it's a big concept in today's world, then we'd have the public health system that people with intellectual differences deserve.
Thank you.
I think it's my turn.
Yes.
I get to ask you a question. So you're a model for people. You're a person with an intellectual difference who has fulfilled a lot of your dreams. You're working, you're married, you're contributing to your community. In the language of today, you're thriving. You're living a meaningful and powerful and joyful life as we would all hope to live. What advice do you have for public health and healthcare systems to ensure that all of those systems are more inclusive and are better capable of producing outcomes similar to the ones you've experienced?
Thank you, Tim. I would have to say, include me in my community. I need to feel like I belong in my community. I need to feel like I belong in the organization. I need to feel like I belong in the doctor's office. I'm the patient. I'm the one that people need to talk to. And not my mom, not my dad, not my provider, not a supporter. Yes, all those people might be great people, and I do need the support to be the best person I can be, but everyone can. And I think that if you just include me and I feel like I belong, then that would be the best thing. And the way that you do that is plain language. And what I mean by plain language is language that everyone can understand. As you just heard, I have an intellectual disability. I never went to college, so therefore I might not understand these fancy words and big words, as I call them.
Right.
And
Almost nobody understands them, so don't feel bad.
but then I need to feel like I belong.
Yeah.
And the way I belong and the way that I have to be part of the conversation is to ask you to make it in plain language so I can feel like I belong. And but I think also belonging, and I need to feel like I belong.
Thanks, Liz. Well, we have a lot of work to do. We have a lot of work to do with our colleagues in the CDC, with retraining, in fact, the entire public health system. But many people want to know. We meet with dentists and doctors. I know you do all the time. They want to do better. For some of them, this is all new. So you've trained them in, I think, two powerful principles: believe in me and make sure that I belong. And if I could summarize all the work we've done over 20 years with the CDC, it has been about trying to make those calls to action a reality in the system. And so we thank all of you for joining us, and I thank you, Liz, for being a model.
Thank you.
I'd like to thank both Liz and Tim for joining us and for sharing the important information with our audience. This is my last Beyond the Data, and it has been my honor and pleasure to bring these important public health messages to this audience. Please look for our podcasts in the future. Thank you.